And a warning to share tonight from health officials. We have, they say, a long road ahead of us, longer than you may think. Dr. Anthony Fauci saying that the U.S. may not be back to normal until 2022. Brooke Katz is in the Fort Worth studio tonight with reaction to that and a little more on it. Brooke?
Doug, I talked to Dallas County's Health and Human Services Director tonight, and he says it may be July before a vaccine is widely available. Meanwhile, there is growing concern people won't take the proper precautions as we head into the holidays.
I think everyone, throughout the world, there's been this sort of COVID fatigue and these cycles of people sort of letting their guard down.
But Dr. Philip Wong says now is not the time to let your guard down.
Our hospital numbers are going up, and some of the projections are, we could potentially go to 1,000 to 1,200 patients a day. But we know what to do.
While pharmaceutical companies race to get a vaccine on the market, health officials warn it will take time to get it out to the masses.
It's going to get pretty bad this winter. The numbers are going up quite aggressively.
Dr. Peter Hotez is the co-director of Texas Children's Hospital Center for Vaccine Development. He is urging everyone to be cautious as we enter the holiday season.
I'm advising people to identify the individuals you want to social distance with over the next few months. Try to avoid seeing others if you don't have to, and look after your mental health as well.
Dr. Wong points to what happened back in July as the example of what to do going forward. The statewide mask order, events being done virtually, more people staying at home, and a drop in the COVID numbers.
We've shown that when everyone does buckle down and do the universal masking and, close the bars and avoid crowds and telework when you can and do the 6-foot physical distancing, it works.
And just to make it clear, the doctors are not just looking purely at testing. We know more testing means higher numbers. But Dr. Wong says they are closely monitoring hospital indicators independent of testing, things like COVID patient admissions, ICU numbers, and deaths. He says we know those numbers can shoot up quickly. Doug?
We've seen it before. Brooke Katz, thank you.